You may have realized that being healthy feels different than it did in the past now that you're over 50. If you want to maximize your health potential but don't have time to read through overwhelming pages of Google links, this is the show for you. Welcome to Healthy Tips After 50. We love doing the research, finding solutions, talking to health experts, and learning what works and what doesn't. Now, your host. She spent the last 25 years dedicated to feeling her best and is here to share her best findings with you, Susan Rosen.
Hello, everyone. This is your host, Susan Rosen, and my guest today is a orthopedic and sports physical therapist, and his name is Rick Olderman. I hope did I get that right?
You got it right.
Okay, good. And really happy to have him here because as we were just chatting about before I turned on the record, is that these kinds of things and the what he's learned in 25 years in this business is that people have a lot of aches and pains, and as you get older and over 50, they tend to be even more recurrent in your life. So welcome, Rick. I'm really happy to have you here.
Thanks for having me, Susan. Appreciate it.
Yeah. So tell us just a little bit more kind of about your practice and how and why you got into doing physical therapy.
Sure. I began, over 25 years ago, and I had back pain of my own back then. And I'd gone to a physical therapist a couple of times, helped, but it came back. And I was in the process of going into PT school. So I thought this kind of doubled my desire to see what the insider secrets were to back pain. And what I learned and prior to that, I had some idea that that something I was doing was causing my back pain, right? It seems intuitive. But in PT school, it was not taught like that. Basically, in PT school, they break things down into components. If you have back pain, here are the structures that are probably irritated, torn, whatever. And so we drill down and we treat these specific structures. And this isn't just for PT school, it's medicine in general. Wow. In Western medicine, our model is that we need to identify the structure that is damaged. And we have a million tests and scans to figure that out. But there's not one test that is designed to tell you why that tissue is damaged. And that was what I was missing, I felt, from PT school. And I had this haunting feeling that I wasn't prepared to be a PT because I didn't understand the whys behind anything. I was just taught that is damaged. And that kind of bore out in my first job after PT school. I considered myself a miserable failure at any injury that was over 3 months old, any remotely chronic. I didn't understand why that was happening. And acute injuries, that's what we were taught in PT school. But chronic injuries, we weren't really taught how to look at this differently than this component thinking. And if you have chronic injuries, it's definitely something that is, it's what I call systems thinking. You need to have an understanding of the body as a system and how everything works together. And you would think this would have been taught in PT school, but even today, I've had a clinic for 10 years and I've trained lots of therapists to work at my clinic. Not one of them has been trained in a systems approach to solving pain. It's all component thinking. And I understand that. There's a national board exam that you have to pass to become a physical therapist. So they have to train people according to that national board exam. But in the process of doing that, we're missing a big piece of why pain is happening and how to solve it. And so that's what I've been figuring out these last 25 years and developed this systems approach to solving pain.
Oh, interesting. Okay. Can you tell us a little bit more about that systems approach?
I sure can. So I'll even, it's easiest if people feel the systems approach. So I'm going to just take you through a couple little easy things to do. Most people listening probably have back pain. And so that's really common. And so I'm going to take everyone through a little test. And this will help you understand one of the fundamental reasons why you're having back pain and actually what you're doing that's contributing to your back pain. So, and I find it better that rather than just listen to me, actually do this test, because if you feel the truth in your body, then you know it. But if you
Yeah.
just listen to me and say, oh yeah, that makes sense, in 5 minutes, you're not going to remember what we talked about, and it won't have any importance in your life. So
Okay.
here we go.
Does that mean I have to stand up?
No, you don't have to.
Good.
I'm
Okay.
more talking to your listeners, but if you want to
Okay,
do this,
good.
Susan, you don't even have to
Well, we'll
watch
see.
me. You don't even have to watch me while I'm,
No,
while we
that's
do this
okay.
test.
No.
So what we're going to have everyone do is just lie down on the floor with your legs straight.
Okay.
All right. And on a firm surface, it's preferable. If you have a couch or a bed, that's okay too. You'll probably feel it, but you'll feel it more, this test more with a firm surface.
Okay.
So we're going to lie down here for 20 or 30 seconds. And I want you just to feel what your back feels like in this position. All right. And now what we're going to do is we're going to bend your knees so your feet are flat on the floor.
Okay.
And we're going to compare the two. Does your back feel better with your legs straight or with your knees bent? And if you don't notice a difference, then go ahead and you're exactly right. And
I can
those
tell
of you
right
listening,
now.
if you don't feel a difference, then hug your knees to your chest and then you see, check there too.
Right.
So you're absolutely right, Susan. Knees bent. And 99% of the people listening to this podcast right now with back pain will say the same. And so if you straighten out your legs again, you'll then notice what is the difference between the two positions for your back. So with your legs straight, you might notice that your back seems a little bit more arched off the floor. And with your knees bent, you feel like your back is flatter to the floor. So you're not, though, having back pain because your back is too arched or that your back needs to be flatter. Really what we're doing is when your legs are straight, there are forces coming from your legs acting on your pelvis and back that are causing your back to experience more of an arch force. And when we bend the knees, we remove those forces and your back resumes the shape that it wants to be in. That's why it feels so much better. So that's the first part of the test. So the second part is now stand up and listen to the rest of the podcast. And so most of you listening will likely notice that after a minute or two of standing, that you're locking your knees straight.
Especially women. Especially women.
So I don't know about women versus men, but I know it's very common, for both sexes. And so what I would say is now, if your knees are locked straight, I want you to feel what your back feels like right now. And now what I'd like you to do is unlock your knees and feel what your back feels like then. And if you don't notice a difference, I want you now to lock your knees again, and you'll notice what just happened to your back when you locked it. And I imagine, Susan, you can imagine what just happened to the back when you locked your knees. Did it arch more? Did it arch less when your knees are locked? It arches more.
Yeah, it arches more in the wrong direction.
Right. So on the floor, we discovered that your back feels better when there are forces removed from making that back arch more. And now we've just found that when you stand for more than a minute or two, you tend to lock your knees straight, which is arching your back more. So this is just a little thing that I figured out over the last 25 years is these kinds of habits that we're doing that are causing pain. So if you simply unlock your knees when you're standing and walking, if you think about taking 10,000 steps a day, that's 10,000 hammers you've just removed from your back, right? Because every time you lock your knees, you're causing your back to arch, and arching your back hurts your back. So this, though, is an unconscious behavior. And so it doesn't rise to our brain's awareness that this is something that we should address, that it's linked to our back pain, because it's a natural behavior. And so what we're assuming is that our natural behaviors are therefore good behaviors, but they are not, just as you just found out with knee locking when you're standing.
Oh, yeah.
Right?
Yeah.
So that's a little example. So this, in fact, and this isn't just something to say, oh, that's interesting. Believe it or not, I solve a lot of back pain just by getting people to unlock their knees. It's a huge hammer on the back. And there are many other hammers that people are doing throughout the day that are causing other aches and pains throughout their body.
Oh, yeah. Yeah. Well, the thing is, as well, and you being a male probably would not have seen this, is that women and girls are taught to stand with their knees locked, right? And to push the pelvis out.
I'll tell you another thing.
You watch all the models and stuff walking around. That's how they walk around.
Oh, it hurts me to watch them. So here's another thing that causes more women to have back pain associated with this is that, especially if you've bore children, So
No,
when women
but I
become
understand.
pregnant,
Yeah.
the weight of the fetus
Uh-huh.
is pulling the belly forward and causing the back to arch more, and it causes the pelvis
Okay.
to tilt forward more, which then
Okay.
reinforces that. And
Ah.
because of that extra weight, women gradually start to lock their knees because it conserves energy.
Yeah.
When your knees are unlocked, you have
That
to use
makes
your
sense.
muscles to hold you up. And when your
Uh-huh.
knees are locked, now your joints
Yeah.
are holding you. So it's a lot easier to stand. Well, what happens though, after that baby is born, you don't unlearn that bad habit that you just learned. And so that stays
Yeah.
with you
Yeah.
now. Because,
Yeah.
well, frankly, you're
Well,
carrying
especially if
now
you
a
have
bigger,
more than one.
well, yeah, and you're carrying a bigger child, right? Because you're carrying
Yeah.
on your hip or you're carrying in
Oh,
your,
no, absolutely.
whatever.
Yeah.
So now you're locking your knees, and that becomes more of an ingrained behavior leading to set you up for more back pain. So
Mhm.
there's another
Yeah.
example.
Yeah.
So
Yeah.
what my approach is about is not only solving the habits that are
Mhm.
causing back pain, but because you're locking your knees, let's say,
Mhm.
tight or weak muscles ensue because of that
Mhm.
behavior.
Mhm.
And
Mhm.
so what my approach is not only just fixing the habit, but you've got to solve the tight or weak muscles that have occurred because of that habit. And
Mhm.
that
Mhm.
restores balance to the body and eliminates pain.
Okay.
It's as simple as that.
Okay. Yeah. No, that makes perfect sense. That makes perfect sense. Yeah. It's interesting. The people, typically men, who I've seen who don't do that are men who, and probably women as well, but I haven't known as many, who played athletics, basketball, baseball, whatever, because they were taught to, bend their knees and stick their butts out and right, and all of these things that are the more proper way to be standing, because
Yeah,
they needed to be in that kind of a position to make a fast right, left, forward, back,
right.
whatever.
That's
You can't
true.
do that when your knees are locked and your back's
Hmm.
locked.
True. Yeah.
Yeah.
And also one of the other things that contributes to this behavior is that as we get older, we exercise less.
Oh,
We gain a few pounds.
yeah.
So we,
Mm-hmm.
just like that pregnant woman, we start to
Mm-hmm.
lock our knees more to help us carry those extra
Okay.
pounds too.
Yeah.
So there's a lot of reasons for this type of
Yeah.
behavior, but that's just one small example. So those of you who have back pain, just try unlocking your knees for the next 3 days. And I can almost guarantee that you will reduce your back pain significantly. So it's not a small tip. It's a big thing that you have to change in order to
Yeah.
feel better. So
Yeah. Yeah.
pretty
No,
important.
absolutely. And it's one of those things I would think as well, is that if you do that, then you can see whether either A, you still have any back pain,
Mm-hmm.
and B, where that back pain actually is coming from. Because
Exactly.
you've taken away this thing that kind of mushes everything up,
Yes.
right?
Well, if it reduces your back pain, you've learned a really important idea
Mm-hmm.
that if I can reduce the things that are causing my back to arch, then I can reduce my back pain.
Mm-hmm. Mm-hmm.
Unlocking the knees is just one small, tiny thing, easy for anyone to do. You don't need any extra equipment or time to do it. Right? So anyone can do that. And that will give you great insight as to what's behind your back pain.
Yeah.
Now, there's another pattern of issues that relates to back pain. And if you don't mind, I'd like to go into that.
Oh, yeah, sure.
Okay. So is this going to be on video?
It is. Well, part of it. Yeah. They're in a couple places. Otherwise, it'll be audio. So.
Okay. So we just learned that arching the back can cause excessive back pain.
Okay.
Right?
Let me just tell everybody that he's showing us a skeleton and moving it around. So if you really want to see it, go watch it where I have video, which is YouTube and my website.
So let's say if you have unilateral back pain on one side of the back, or you have sciatic pain in one leg, or you have SI joint pain in one hip. All right. Usually that's because of another pattern that has developed in you. And that is that, let's say the pain is on this side, the skeleton's right side here. So the skeleton's right hip or pelvis is typically higher on that side, and the rib cage is typically lower on that side. And I call this a side bending problem. Okay. And so when a side bending problem occurs, you have more compression on the nerve roots exiting this side of the spine that comprise the sciatic nerve. All right. So the other thing that is going on is that this whole pattern is developing because of some old injury to the right leg somewhere.
Okay.
And this is really, it's actually kind of funny. Whenever I talk to people about, oh, you've got a right sideband problem, and I think it's due to some old injury in your right leg. They're like, I don't have any old injury in my right leg. I don't have, and so only after that forces me to go through the whole leg and figure out where the injury is. And they're just like, oh, right. Yeah. Oh, that knee. I forgot about that knee injury back in high school kind of thing. And so, oh yeah, I tore my meniscus and I had to have it repaired, but and so
right. Nothing small, right?
well, this is the funny thing is, because we're so trained not to think of old injuries as contributing to our current pain. This is completely off of most people's radar.
Okay.
And so even when I prompt them for their old injuries, that connection is so vast between the old injury and the current pain that so many people can't even come up with it. So trust me, if you have this pattern in 99% of the people, it'll be because of an old injury onto the same side. So ultimately, to correct this pattern that may be causing your SI joint pain, your sciatic pain, or unilateral back pain, ultimately, you're going to have to address whatever old injury is here and correct it. All right? Because this pattern is happening because your brain has to do something to get you off of that injury. And the way it does that is hiking up the hip to get you off the leg. It's called a withdrawal reflex. We're all born with this, and you can watch YouTube videos of them. And it's a natural hardwired reflex in our body that over time we override with our prefrontal cortex, because we can't go through life indiscriminately responding to reflexes, right? Every time we step on something, we can't just jerk our whole body up, right? So our brain develops we tap into that old reflex to get off an area of pain in the body. And this is why that area of pain doesn't hurt anymore, is because the brain has done this. Right. So now, I've solved that problem. That knee doesn't hurt me anymore. Great. Right. But 5 or 10 years later, you've developed sciatic pain or SI joint pain or unilateral back pain because of that compensation pattern that is unconscious on your part.
Okay. And or started to make the other side hurt because either you're putting more pressure on that side to compensate. Yeah.
You'll develop an overuse issue on the other side.
Yeah.
Exactly. And so if you have some vulnerability in this side, now that's going to have pain. And so this will be addressed, but its relationship to the opposite side was never figured out, because whoever the practitioner wasn't thinking from a system standpoint. They weren't looking at both sides of the system from rib cage to foot.
Yeah. So. Yeah. Which is actually more normal, if you want to call it that, with practitioners, from using more of the Eastern types of medicine. They're much more into the whole look at the whole body.
Yes, they've bought into the idea that we operate as systems. Yeah. But even in Eastern medicine, I haven't encountered an Eastern technique that understands the musculoskeletal system from that standpoint.
Oh, okay.
And how we move.
That's unusual.
Yeah. So Eastern medicine is really good at, for instance, acupuncture, internal medicine issues, and so forth. And of course, acupuncture can help with, back pain and things like that. But that's addressing it from a meridian standpoint, not from a musculoskeletal standpoint.
Okay.
And so
interesting.
The biomechanics of that pain aren't taken into consideration typically with most acupuncture treatments.
Okay.
I am not an acupuncturist.
Right.
But those who I've talked to,
biomechanics
is not part of their training. It's the meridian system.
Okay. Interesting.
So that's basically how my approach works, is understanding everything from a system standpoint. And of course, you're going to have to drill down and fix a particular issue, but you're always drilling in and then backing up again to see how that's affecting the whole system again.
Yeah. No, that makes a lot of sense. So is there a particular type of therapy that all of this falls under, the systems kind of,
Well,
or did you just develop it yourself?
I developed it over these last 25 years.
Wow.
So it's all under the guise of physical therapy. But frankly, Susan, most people who get injured, I'm the last person they'll come and see, right? So they're going to see a personal trainer, well, their doctor, but even then they're going to go to their personal trainer first, their yoga instructor, their Pilates instructor, their coach. All of those people are the first in line. And so those are the people who really need to understand this,
right?
Because so much inaccurate information is being dispensed out there about injuries, why they're happening, and how to solve them. And so if those people could learn this system, then I think that we could really get rid of a lot of chronic pain in the world. And so I've also created an online training program for health and wellness practitioners to learn this way of looking at the body to solve pain.
Okay, great. Well, we'll have to get all that information afterwards, and I'll put it in the show notes and stuff for everyone. And I guess you have a couple books as well. Yeah,
I've written 6 books about 10 years ago, called the Fixing You series. They're available on Amazon, and they're all designed to help people solve their own pain. There's one for back pain, there's one for hip pain, foot pain, and so forth. However, I've owned a physical therapy clinic for the 10 years after I wrote those books. And so what the physical therapy clinic, because I had such a high volume of people coming in, I started to see that all of these things were happening in patterns. So it helped me narrow down that, you've got back pain, but the same thing that's causing your back pain is causing someone else's sciatic pain. And that's also the same thing that's causing someone else's SI joint pain. So what I've learned over these last 10 years in my clinic is that I can, for instance, if you look at my back pain book on Amazon, I've got maybe 80 different exercises in there, right? Because I'm trying to solve every little thing that could possibly go wrong. But what I've learned is 99% of pain is caused by these 3 or 4 things, regardless of whether it's back, sciatic, SI joint, whatever. And so what I've done is I've created downloadable home programs that are much more specific, streamlined, and shorter and faster than what's in my books. And those, as well as my online training program, are on rickolderman.com, RICKOLDERMAN.com. And if you type in Fixing You, all one word, FIXING, you can get 20% off of whatever you purchase there. So while my books have been really helpful, these downloadable home programs are more comprehensive, yet simpler to use.
Yeah, I would think so. Because people, I could see where people have a real issue, just because we're human, reading a book and trying to use it and apply it.
I have created videos. I knew that. So I created videos associated with those books so they could see me doing the exercises with someone. And so, because I wanted everyone to read the books and solve their pain. But then I realized, because I was trying to solve every type of possible pain out there, I couldn't narrow it down for anyone. Because what if someone had this problem and another person? Well, the clinic has taught me that, I can really narrow this down because it's a common pattern of issues that are causing pain in everyone. And so that's the beauty of the home programs versus the books now. It's all still videos, but it's just more streamlined. So like one exercise will fix 3 things instead of one for one thing in the books.
Oh no, absolutely. Which makes a lot of sense, because typically it's the old, what is it, the 30-60 rule or whatever they call that, the 90-10 rule or whatever, where you can figure out something or some answers to things, and you can actually give answers to the majority with the smallest number of actual answers, right? Rather than than trying to cover everybody. And there's going to be a small percentage that are in all that other part, but you can cover 2/3 or 3/4 of it with this much.
Absolutely.
And that's applies to everything. Talk about systems issues. I mean, that's that's where that comes from. Yeah.
Absolutely.
Yeah. Yeah. So it's a lot faster and it's a lot more successful
It is.
typically,
It is.
because people don't have to start going, through a book like this trying to find something that applies to them.
Right. Right.
Yeah.
Just case in point, the knee unlocking
Uh-huh.
tip we started with.
Uh-huh.
All right. That not only helps back pain, but it'll help hip, knee, and foot pain, as well as plantar fasciitis. And we don't need to go into all the reasons why that might help all of those things. But I use that technique to solve a lot of things, because what it does basically, in a nutshell, is it gets the lower body system to start working the way it was designed to work. It's not designed to work with you locking your knees when you're walking. That's not how you're supposed to be walking. And so no one in my clinic would leave if they have any injury from the rib cage down to the foot. No one would leave without us teaching them how to walk correctly, because it's so integral to pain.
Oh yeah, I'm sure.
And it's much simpler than you think. And you can't walk correctly unless you learn how to unlock your knees. So if you can learn how to unlock your knees in the next 3 days, you're way ahead of the game.
Yeah, no, I need to learn how to do something, because as I say, I trip over, cracks in the sidewalk, just where the sidewalk's off.
Yeah.
My husband spends more time, I think, watching to make sure I'm not falling so he can grab me when I start to go down.
So I wanted to, if you don't mind, Susan, I want to address this idea of changing habits.
Okay.
So,
please.
and I want everyone to go through a little experiment with me. So I want you all to grasp your fingers together as if you're praying. So go ahead and do this. Now, look down and see which thumb is on top. Is it your left or right? Left for you. Okay. Now, without looking at your hands, what I'd like you to do is ungrasp them and then clasp them again with the opposite thumb and finger on top.
Oh, okay. Okay.
All right. Now, a lot of people had to look down at their hand to make sure that they did that correctly. Are you sure you did that correctly, Susan?
Yes, got the right one on top.
Good. Now, keep your hand in this position. So you'll notice that this feels weird, right?
A little bit, yeah.
It's different than what you normally would do, which is having the left thumb on top, right? So what often we do is our brain sends out an alarm. When something is different than the way we've always done it, your brain sends out this alert and alarm that says, whoa, something's changed here. And often what we do is we judge it as being wrong because it's different. But this is exactly what I'm talking about. Locking your knees straight isn't different. That's your normal way of doing things. But now you know that it is contributing to your pain, right?
Right.
Unlocking the knees is unnatural. And your brain is going to send out alarm signals that say, wait, this is all weird. No, don't do it. Because you're going to judge the difference as being wrong.
Right.
But you don't know whether it's wrong or not, because that difference could mean the difference in your pain. But your brain doesn't know that yet. Only your body will tell you that. So when you're changing habits, have patience. And just because the brain is sending out these alerts that say, whoa, something's different, it doesn't mean that it's bad. It just means that it's different. It's going to take you a day or two to understand really whether that's a bad change or a good change.
Right.
So I just wanted to alert people to that.
Sorry. I got so involved in it, I swallowed and it went down the wrong way. Not the coffee, but me. No, that makes a lot of sense. That makes a lot of sense. And I'm assuming, and I may be wrong, if I do start bending my knees, that I will pick up my feet more.
That's what I'm hoping.
Yeah.
Because right now, when you're locking your knees, your feet don't have many opportunities to do anything other than just slap on the ground. But when your knees are softer, now you'll notice that you have more opportunities. You have more options for how your foot can interact with the ground now.
Okay. And if I pay more attention to picking up my feet, will my knees unlock along with it?
Well, the knees unlocking has more to that happens when you strike your foot on the ground.
Okay.
All right. So of course, when you're picking up your knees more, the knees are going to bend more, right? But that's not what we care about. What we care about is when that foot strikes the ground, because now that foot is carrying your whole body weight.
Right.
And if your knee is locked at that point, your whole lower body system has missed its opportunity to function correctly.
Okay. Interesting. Okay. Well, I'll try it.
Okay.
I'm game.
It works.
I have no doubt. I trust you implicitly. That's, I just need to start doing it. And I actually am aware of that. And I do think about it when I'm standing, just not necessarily when I'm walking. So that's what I need to do, is switch my awareness. Yeah. Because if I stand for too long and my knees are locked, that gets painful.
Exactly.
Yeah, for sure. Okay. I'll try it. I'll let you know. So that sounds like a really basic one. What about for people who already unlock their knees, like a lot of men, like I was saying, who still have back pain? Is there something else that is it maybe the way they're sleeping or their mattress or their, I don't know,
So
I'm just guessing.
So everything always comes down to why you're having back pain.
Okay.
Right? So first, do the test at the beginning of the podcast that we talked about.
Right.
To determine, oh, my back feels better with my knees bent. Okay. That means then that something I'm doing during the day is causing my back to arch more. And that's what's contributing to my back pain.
Okay.
Right? So unlocking the knees is just one of them. But the key here is that I can't be in charge of your life for you. Right?
You can't? Oh,
you have to be in charge.
Okay. Yeah.
And that's why it's called fixing you. It's you fixing you, not me fixing you. Right?
Okay. Got it.
So you have to learn to think about, as long as you believe that something you're doing is contributing to or causing your pain, then you have the tools to solve it. And my programs and my books give you the way to think about it, as well as the specific exercises to do to solve it. Right. But in terms of this podcast, that one test at the very beginning, that should be enough for you to start investigating your life and notice whether, I'm sitting with my back arched. What happens if I sit with my back less arched? Or, when I sleep this way, my back feels arched. What can I do to get my back not to arch as much? Yeah. It's as simple as that. It's so simple. But I've worked out all of these little permutations throughout these last 25 years, so I can speed things up for people, right?
Yeah.
But if you want to be your own investigator, this basic test will give you a lot to go off of. And then also, I talked earlier about that side bending problem, right? Yeah. With the pelvis higher and the rib cage lower. So here's how it shows up on a person. If this has been around for a while in you, what you'll notice is have someone take a picture of your back with your shirt off. Okay. And what you'll see is on the side of the side bending problem, you'll see a bigger crease in the back than on the other side. And if you see that bigger crease on one side of your back versus the other, it means that you've got a side bending problem. All right. And what did we say about side bending problems? The side bending problem is happening because of some problem in the same side leg. So you can start thinking about this. All right.
Yeah.
So, that old knee pain. Well, that side bending problem is happening because you're walking differently on that leg versus the other leg. Okay. So notice how you're walking. Yeah. And start fixing it. Compare the two legs. When I walk on this side, I'm doing this. And when I'm walking on the other side, I'm doing this. What if I just don't do that on that side bending side? And lo and behold, in a few days, my pain is decreased 50%. Right? No. So you're now just starting to use your body more symmetrically and the way it was designed to be used. Okay. It can be that simple, Susan.
Okay. I'll have to try that. I know that actually when I sleep, I have a not big pillow, but a fairly kind of flat pillow that I put under my knees. And when I get on my side, I put it in between my knees. And I've been doing that for decades, probably.
Yeah.
So and that was because my back was,
arching
flat
when your legs are straight. Right.
Yeah.
So and that's a perfectly fine solution if you're content with that. But we can also solve the reason your back is arching too much when your legs are straight.
Okay.
So you don't have to use the pillow.
Okay.
But if you're happy using the pillow and that's all the problem that you have is while you're sleeping and this pillow solves it, then why not just use the pillow? But if you're having that back pain happen other times of the day, then you might want to think about solving the forces that are pulling the back into an arch excessively in the first place. Then you won't need the pillow, and then you won't need any of the other things that you're doing throughout the day.
Okay. Yeah, I have intermittent back pain.
When it rises to the level that you're going to say, I've got to do something about that, then believe it or not, you're going to do something about it. And so that's where my programs come in. But if it's not at that level where you're just like, it's intermittent, it's no big deal, then why change your whole life unless you have some major episode and this is a recurring thing that's really bothering you?
Yeah. No, I have, like I say, the biggest thing that bothers me is not picking my feet up, and just because of the ramifications of that.
Sure.
And the other thing is that my right shoulder is lower than my left shoulder.
Are you right hand dominant?
I am. I also broke my collarbone.
Well, a right shoulder
3
lower
years ago, and it was after that
on a right hand dominant person, the right shoulder should be lower.
Okay.
So that's not necessarily
a bad thing.
Yeah.
Okay. Yeah. Well, like I say, it got more noticeable after I broke the collarbone.
Sure.
Primarily because it was right before COVID, and I couldn't get in to get physical therapy.
Yeah.
Because it was all over Zoom, and that was worthless.
I help a lot of people through Zoom.
Oh no, I'm sure.
And this is the thing. Component thinking, it's hard to solve pain through a Zoom session. Systems thinking, very successful with Zoom sessions.
Okay. Yeah. No, I just never. It's just never come back totally. And
again, if it rose to the level that you felt that it needed to come back totally, then I'm sure you would do something about it, right?
Yeah, every once in a while I start looking. Usually after I do a Zoom call, because then I'm seeing myself and I'm like, God, there's my shoulder.
Right.
I get this way. Right.
Now you can give yourself a little, leeway, because that shoulder is supposed to be a little lower. So don't beat yourself up too much.
Yeah, no, that's true. It's just, it's a little more than a little bit.
Yeah. We're all different.
But that's okay. So let me ask you one more thing, because we've been going on for a little while now. A lot of people do not stand up straight, right? They've got their especially as they get older, they start to hunch over. I would think that's not, I don't want to use the word normal, because that's obviously is the normal, but that doesn't necessarily have to be together.
Well, this ties in perfectly with what we've been talking about.
Okay.
So I'll explain that. So if you have pain because your back is arching too much, right? How do you get out of that pain?
You lean forward.
By flexing the back.
Right.
So the people who are hunching forward are trying to get out of their pain, because if they try to get up, they're going to say, "Oh, but that kills my back."
Yeah.
All right. So that's why they're doing that. So what they're doing is, this is an unnatural way to solve that problem, though.
Okay.
You're right. It's not a normal way of going through life like this, right?
Yeah.
Why don't we instead solve the reasons that your back is too arched?
Okay.
Or that it hurts to be up straight. You can solve those. So that's what's going on with bending over walking. Most of these people are, if you get them to not do that, it's going to kill their back. All right. And that's why you see people leaning on the shopping carts, pushing them forward like this, bending over, because it feels so much better for their back.
Yeah.
Right?
Yeah.
So this is another one of those things. Well, if you're content walking around like this, bent over, then you need go no further. If you're happy doing this in life, who am I to say change something? But if you're not happy walking around looking like this, then why don't you now change the reasons why you have to walk around like that, so that you can be up taller, right?
Yeah.
So that's what's going on with that phenomenon, and it plays right into that whole excessive arching test that we did at the very beginning. Right.
Okay.
My back hurts when it arches.
Because I noticed some again, especially older people, but it's like they've gone down, right? And it's not necessarily that they're hunching over this way. They just seem to be hunched a little bit, but not a lot, but more like down.
Compressed.
They've gotten shorter. Yeah, they've gotten shorter.
Well, our discs, degenerate as we age, right?
Okay.
So we lose significant height when that happens.
Okay.
And that's a normal process. This is another thing, is that a lot of older people, they'll go in, they'll have back pain. They're going to go into their doctor. They're going to get their MRI, and they're going to see all these structural things that are going on to their backs, and assume that those things are what the things are that are causing their pain. But there are studies that show as we get older, we have more and more of these structural changes with no pain at all.
Right.
So
yeah,
the structural change
don't have any that I know.
Yeah. So the structural change does not mean that is the cause of your pain. Those changes are natural as we age, just like the disc degeneration.
Yeah.
Arthritic changes, all sorts of things. That's all natural. It doesn't mean that that's where your pain's coming from.
Got it. Okay. So it's not necessarily something where if I see it in somebody, I should be, boy, you really,
I'm sure they wouldn't be pleased to hear that.
No, they aren't. That's why I usually don't say anything.
Yeah. Again, it all goes back to, there's this, my family kind of has a saying, let's see, well, I can't remember it, but it's funny. I haven't said it for so long, but basically when something rises to the level, to stay this way is just too painful.
That's right.
You're going to make that change.
It'll come up.
But until you rise to that level, you're going to let it all just go.
Yeah. Yeah. No, exactly. Yeah. And
my neighbor across the street,
as we get older.
My neighbor across the street, Susan, walks just like you were, bent over.
Okay.
I've talked to her several times. Hey, I can help you with this. We can solve this.
Right. Yeah.
She refuses to take action on it.
Okay.
That's her choice.
Yeah.
Yeah.
Oh no, exactly. And I just, I know even myself at my age, I've lost like half an inch. And others, because I know a lot of people that are older in their 70s, say for instance, or 80s, and I can see that they're shrinking.
Sure. It's a natural phenomenon.
Yeah. Okay. Just curious.
Yeah.
Figured I got an expert here. I was going to ask, right?
Yeah. There you go.
I will keep my mouth shut.
No. If someone's complaining about something,
no.
then you don't have to keep your mouth shut. But if they're not complaining, then
no, not complaining.
Yeah.
None of them, men and women. So yeah. Interesting. Because I know that never even occurred to me. Huh. Okay. Well, that's an eye opener. So
good.
Thank you. That's
my pleasure.
That makes this program even more valuable.
Good.
So, okay. Well, any last things that you'd like to just, either reinforce or, whatever,
Yeah, a couple things. One is, I run into a lot of people because I tend to focus on people with chronic pain. I run into a lot of people who think that they're broken because they've been to a myriad of practitioners, no solutions, surgeries, all sorts of things. But I'm telling you, no one has probably looked at you from a systems point of view. As crazy as it sounds, they haven't. And this is probably why you still have chronic pain. So you're not broken. You just haven't had the right information yet. And then the second thing is, if you decide to, if you want to look into my home programs, go to www.rickolderman.com.
Okay.
Type in Fixing You, all one word, for 20% off.
Got that.
And then also I have an upcoming book coming out in 2023 that you can pre-order. And they are case studies from the last 25 years of me practicing that illustrate these principles that we've been talking about on this podcast. And so you can see my thinking and how I approach all sorts of different types of aches and pains. My hope in writing the book is to give people hope that they can solve their pain. There you go.
No, I think that's great. All of that. Totally. So I appreciate it. I'm going to go check out your website for sure. And as I said, I'll
there's
put
some free stuff on there too.
Well, we all love that, right?
Yeah.
And I will, what was I going to say? Anyways, so they'll all be in the show notes as well. So people don't have to start scribbling or stopping the podcast and write part of it and go on back to the podcast. I know that part well. So,
well, thanks for
anyways,
having me on, Susan.
yeah, well, thank you. Thank you for being here. It's been very valuable to me, and I'm sure it's going to be very valuable to other people. So I do
Good.
appreciate it, and I appreciate your what's the right word? Your feeling that this is a very important thing for people to learn that's going to make their lives better. And you're not, not that you don't want to make a living, but I get from you that you're doing this because you want to help people.
Oh yeah.
And
Definitely.
let them help themselves.
Yeah. It's time to get the word out.
Yes, exactly. So let me finish and wrap up here by saying that this is not medical advice. And even though we have a registered or licensed physical therapist on us, we're not doctors. And this, again, is not medical advice. So if you are having any kind of issues, please go see a doctor or somebody that's like Rick, if it's a back problem. And with that, I will say what I always say, which is that I will be talking to everybody next week.
This has been Healthy Tips After 50 with Susan Rosen. To stay on the cutting edge of the most effective health strategies, subscribe to this podcast and let us know what you thought of the show with a comment or like on iTunes. Visit healthytipsafter50.com for this episode's show notes, more resources, and free offers.